Hi everyone, this is Unit 10 Crisis Management Presentation, case number 2 or patient number 2, which is the 19-year-old married female with a 2-month-old baby presenting for her fourth visit. For this patient, safety assessment and intervention will be the priority. The patient does express belief that the baby is an alien, and the plan is to leave the baby in the desert constitute a threat to the infant's safety. So from my perspective, there is no way I'm gonna leave that patient alone with the baby going forward after that information has been relayed to me. I'm gonna ensure the baby's safety is placed as is very important from that point forward. Either way, although the patient did specify that she does not plan on harming herself, I will take the plan of taking the baby to the desert as a serious concern. To me, that is a homicidal risk. I'm gonna assess immediacy and feasibility of that plan. Does she have transportation? Does she have supplies? How soon does she plan to leave? Given the clear risk of the infants, my goal now is to implement an emergency hold. Like in Florida, it's gonna be the Baker Act. The Baker Act does allow for evaluation and stabilization of the patient. I'm going to explain to the patient that this is necessary to ensure the safety of both herself and the baby, including everyone around her. Also, I would I will work with collaboration with other team members to come up with an immediate decision as to whether the patient requires help and what is best for her and the baby. This is a decision I cannot make on my own, having been the fact that I've only been there 6 months, and as a nurse practitioner, I have to work directly with a doctor. Although it is, I can hold a patient, but it would be important to communicate with somebody. That's how I feel. I feel it's always right to communicate with somebody. Mostly when you're new to a place, it's safe. It's better to be safe than sorry. To stabilize the scene, I'm going to request an EMS transportation for the patient to go to a local hospital. I'll also obtain a detailed assessment and during the evaluation process once the patient has been stabilized. Sometimes this might go on in an outpatient facility after the patient has been taken to the hospital and discharged. I would want to obtain a detailed mental status exam. I want to document either way when the patient showed up in my facility. These are things I still have to do anyway in the HPI. I want to document the patient appearance. This is the MSE, the mental status exam. I want to document the patient appearance, the patient's speech, thought process, thought content, including the patient's like her alien's belief, and related idea, perception, cognition, insights, and judgments. I want to inquire from the patient about prior history of mania, depression, psychosis, and other mental health condition. I want to also find out about family history of mental health. And I can obtain all this information where as a way to distract the patient before EMS arrive, I can just obtain all this information and just tell the patient this is necessary for the evaluation process. Since the patient is postpartum, this might be differential diagnosis that might be important for this patient might be postpartum psychosis, given the fact that she just had a recent childbirth. Postpartum psychosis is definitely a good primary consideration. This is because this is a psychiatric emergency characterized with rapid onset of psychosis, often with delusion, hallucination, and bizarre behavior. And I'll attach my reference to this presentation. The other differential diagnosis is going to be bipolar disorder with psychotic features. Maniac with psychosis can present with grandiose delusion and disorganized thinking. I'm going to explore past mood episode to determine if this is new or an exacerbation of an existing condition. I also want to find out if this is a substance-induced psychotic disorder. Although she does deny substance use, it is important to consider the possibility of obtaining a urine drug screen, because sometimes they'll tell you yes and it's a no, and they'll tell you no and it's a yes. So we want to make sure we're backing our information up. We want to make sure we're obtaining facts instead of, doesn't mean they're telling lies, but if we can, we want to make sure we're obtaining more detailed information. To rule out medical condition, we want to make sure we're ruling out other medical conditions like autoimmune disorder, thyroid disorder, and neurologic condition. We do not want to administer medication without evaluation and proper guidance of other healthcare provider. This is obviously going to be a team of other providers working together to ensure we're providing the patients with the best care possible. So we might not it might not be appropriate to just initiate medication immediately. We might want to communicate with other healthcare provider. The patients might need detailed labs like a CBC, CMP, thyroid function test, urine drug test, and if possible, if we're unable to obtain results that is satisfying from the blood work, an imaging might be necessary. We also want to provide psychoeducation to the patient and her family, specifically her spouse. We want to teach them about conditions associated with postpartum, because some of them do not know. So it is our job, part of our job as professionals, to ensure we're providing that education to families. We also want to inform every party involved, the patient and her family, about treatment plan and care plans that is appropriate for the patient, and we want to make sure we're involving them in the communication process. We want to share all findings with supervisors and doctors to see what is the best approach for the patient. Collaboration of care. We also want to make sure we're collaborating even with the pediatrician, other team members, medical doctors and other team members, to ensure the patient is receiving the best care possible. We want to make sure we're targeting the patient's care from a holistic aspect rather than putting ourselves in one specific, rather than caring for one specific I lost my train of thought. Rather than caring for one specific disease, we want to make sure we're looking at the whole the patient as a whole. And also we want to involve the patient's culture. We want to make sure we're involving the patient's culture. We're putting the patient's culture into consideration while we're providing care for this patient. And that will be it for now. I'm going to attach my reference to this discussion. Thank you.